Hi, Dr. Steve Battaglino. Today I want to show you some x-rays to show you the importance of x-ray, what kind of information we get from them that we can't otherwise just glean from our hands. This first x-ray series, this is before and after, so this is the side view of the neck like this, and this is where the jaw is, the base of the skull. On the before x-ray you can see it's very straight. And then on the after x-ray, you can actually see a real nice gradual curvature. What it does, that curvature opens up these vertebrae and discs in the back where we can see they're just about touching here on the before. A big change for the discs and nerve flow coming through there, but also in terms of arthritis as we age, it's crucial to get a proper curvature in there as much as possible. This is a before and after series of a scoliosis patient, young man, 11 years old. You see curvature like this, real pronounced scoliosis. In fact, this patient was just waiting for surgery to have metal rods inserted up and down the spine on either side. We were able to have him avoid that surgery, thank God, and we can see after 4 months of care a very straight spine, much taller and much healthier in terms of energy level, digestion, and things like that. This is a neck curve. It's actually a reversed neck curve. The neck curve, this is the jaw and the base of the skull once again. The neck curve is supposed to go like this and this way. This neck curve is reversed and it causes a lot of stress and strain on the bones and discs and joints and nerves of the neck. We can see actually some bone spurring forming here as the body tries to cope with that stress. This is a similar patient, just fast forward probably 20 years, where we can see the strain over time has caused this bird beak formation, this bone spurring. The body's trying to fuse these bones together to help with that strain of the neck being forward like that. And we can see the disc, which is supposed to be nice and dark like this, is getting to be sort of obliterated there as well. So it's important to catch these kind of problems in the alignment of the spine early on. This is another scoliosis patient where we can see real pronounced curvatures. It's real important to catch this early on as well. You'd think that this patient, for example, would be real distorted walking around, but they're not. It's amazing, but the body finds a way to compensate that makes them look almost straight. So x-ray is crucial to be able to see really what's going on in the main points. This is the lower back from the side view. So this is the buttock here, this is the tummy here, and the patient's looking this way. The main thing on this is a feature called spondylolisthesis. There's your $20 word of the day. It basically means this slippage here. These bones are supposed to pretty much line up with this. This is the sacrum or the base of the spine. This slippage here has a huge effect on the low back, the stability of the low back. It's really important to know that it's there to best treat it. Again, this is an x-ray diagnosis. We don't really know about this by just feeling it. We have curvatures in the neck. This is the left shoulder and the right. We see curvatures there that really can be best treated if we can figure out specifically where it's locked up and why it's doing what it's doing. This is a type of scoliosis that we can't really fix per se. It's more of a support to kind of patch it and keep it functioning the best that it can. But basically this vertebra is wedge shaped instead of nice and cube shaped like it's normally supposed to be. So it predisposes the spine to have that curvature to it. And the body needs that curvature to compensate. We can see things like this side slippage here. It's kind of slipped this way. This is due to an injury probably before the age of 10. This man is probably in his late 60s now. To be able to see what's causing the problem and to fix it in the best way, the most affordable way, the quickest way, x-ray is the way to go. That's your little x-ray lesson, your window into the world of a chiropractic geek who marks x-rays until 9 or 10 at night until my wife calls me and tells me to come home. This is Dr. Steve, and this has been your X-Ray Minute.